C-section, cesarean section and hernia formation. That's the topic today. So even with the modern techniques and everything, even today, when somebody goes for C-section or cesarean surgery, the chances of getting hernia, that's called incisional hernia, is still possible. Though compared to the olden days, is very less, but still a possibility. Like zero point 0.3 to 5.5 percentage of the C-section people can get hernia. That's called incisional hernia. What are the reasons for the hernia formation? The first and foremost is from the patient side or from the surgical point of view. So those days C-section is done in the lower midline incision, but nowadays it's become lower transverse or phalansteal incision or bikini line incision. So the rate of hernia formation has come down. It is very high with a vertical incision. That is number one. Number two is done as an emergency, done as after the surgery there is an infection, or the mother is diabetic, or the mother it's a second or third C-section. The chance of hernia formation is very high. So first is if the mother is anemic, the wound healing, any anemia delays the wound healing. So with a C-section and anemia, chances of delayed wound healing, wound dehiscence and hernia formation, or infection and hernia formation is very high. Or most of the mother, to shrink the abdomen, in Indian practice they use some towel or some cloth to tighten it to reduce these to improve the shrinkage of the abdomen wall. That is the worst thing, because the constriction or the restriction of the muscles, it promotes hernia formation. Instead of that, they can try a hernia belt or the abdomen corset. Abdomen corset is the best option after the C-section. Suppose the formation, the mother is going for second time or third time C-section. So the incision is made on the same, incision. The chance of hernia formation is very high. So diabetic or the people with some very splayed out muscles, the fascia is very thin. Chance of hernia formation is very high. Or they resume back their physical activity against the doctor's advice, like bending or pushing or straining for motion, cough or weightlifting. These things can increase the chance of hernia formation. So you have to avoid at least best is 6 weeks. But they can walk, they can climb stairs, but bending or weightlifting or doing under pressure, doing some job, these things should be avoided. So C-section nowadays, the chance of hernia formation is less, but still possibility is very high. The patient plays a major role in preventing that. So get advice from your doctor and follow the advice. Thank you.